Meghalaya state in India is a very beautiful state, but also a very difficult state. The reason is that the state has about 7,000 habitations, which are highly dispersed, and it's very difficult to provide services, and also from the point of the communities, it's also very challenging for them to access the services on time. Over a period of time, there were a large number of maternal deaths and child deaths. In fact, our MMR was very high, IMR was very high. We have a huge geographical challenges. We also have huge cultural challenges too, because majority of the population is indigenous population, who live in their own communities and with traditional beliefs. How to introduce science to them. We changed our strategy. Instead of solving the problems with default program or existing programs, we thought, like, what is our purpose of these programs? To reduce maternal deaths, to reduce infant deaths. How actually we can bring the purpose before the program. We have used a methodology called problem-driven iterative adaptation approach, which is developed at Harvard Kennedy School. We started encouraging the frontline functionaries, started actually taking proactive initiatives to solve the problems, and the state has provided the facilitating support.
Lembaga BSc, ngi Srilang lembaga ICDS, ngi shong meeting lengkat buat ke ICDS dulu, bania perkat ke jingbam ke bapio nang pi, kumno pi asam pi ai segi kurung segi longkumi, nang tangi shong meeting dulu ban I Asha, bende na po ka kot ke kya po hostel dulu, teki nang tanah blok buruk ni ya shong lang, ngi Srilang.
When we look at reducing maternal death, one important critical point is that within 30 minutes, when the mother experiences labor pain, she has to be brought to the health facility. But 85% of our habitations cannot provide that kind of opportunity for the mother. So we've set up transit homes where the mothers are proactively brought to these facilities and provided proper care along with their children and family, so that they would live next to the health facility, close to the doctor, so that in case of emergency they can be provided good support.
Ngapoy tu Jepang transit room tadi rawan di hospital, dia bang 4 kali I doktor tadi jatuh yang aban tiak nan di pot transit room. Tinggal kali doktor on dah tiak ni kalau doktor yang kalau bekom hayem pelaban semua. Abang kadi ruka biang kom hayem ban tiak ban hayem. Kau ban wan ka hospital mo kam long kan mo kam solution na wan hospital kan mo bagi dan ki nurse ke doktor dan mak na yarap.
Under this program, we also have come up with the idea that we'll provide the wage compensation for you. Similarly, we also set up a system. We can't send an ambulance when the mother started experiencing a labor pain. So what we did was, we have identified the vehicles within this habitation, put them on a service. It's like an Uber kind of a model, under the Chief Minister's Safe Motherhood scheme. So the poor patients need not actually be hesitant of coming to the health facility because transportation services are provided.
The ANMs now utilizing these fleet vehicles, they are able to visit high-risk mother, especially when they can't come and visit to the center. By providing that kind of facility, it's like it's bringing that closeness, like the trust is building between the ANM and the beneficiaries.
Over and above, the most important thing is that there is an intrinsic motivation among the frontline functionaries to save lives. The entire missionary was working with a purpose. All this actually have resulted today the reduction of the maternal deaths by over 50% in the last 4 years, and the infant deaths by over 35% in the last 4 years. When we started getting these results of reduction of maternal deaths and reduction of infant deaths, the state government also got motivated. The state government started investing more on health sector. Today, the state is spending over 9% of the state budget on health financing. This is the highest percentage in the country, because we need to improve the health infrastructure. We need to train more doctors, we need to recruit more doctors. So a lot of reforms have been brought to strengthen the health systems through this project. We need to address the socio-economic determinants of healthcare to provide healthcare. Each mother who passed away because of situations like this is actually making us to work with much more commitment, responsibility to see that no such mother would die in future.